things that families struggle with sometimes is understanding, well, what are we getting, when we come in, when we see a therapist, what's going to be going on, what's my child going to be involved in. And I think families, we definitely want families to be involved. Families need to be involved in the process and be informed and understand what's going on. Therapy and the process of therapy itself is at its core some of what we were talking about earlier. The core elements of therapy is just building relationship and playing with kids. Play is the language of children, so playing with kids, that's still a key aspect of any good therapy, especially with younger kids. The thing about that is it is building some of those resiliency factors that Ms. LeGrand was talking about. Now, there may be very specific things depending on what's going on with your child. There may be very specific skills building that they may work on. If there's anxiety issues, they may work on various types of anxiety management, relaxation skills. There's so a lot of what the therapists are going to be doing is working with you to formulate a plan and then to implement that plan, which may mean an array of specific skills that they'll be working on with the child, skills they'll be working on with you as a parent, to help you as you interact with your child. There's a lot of different models that are used in some ways for therapy, but probably one of the best and well-researched, and it's the core of what we do at our day treatment programs and in our residential program, is a dialectical behavioral therapy model. There are 4 key skills building areas in the dialectical behavioral model. So we want to build skills in distress tolerance. We want to help kids be able to tolerate stressful situations and the emotions that those stressful situations generate. And then we want to also help them build affect regulation skills. Affect regulation skills are sort of like the distress tolerance skills. It's like you're in a stressful situation, you have strong emotions. What can I do to change those emotions? What can I do to modulate and to bring down my emotions and to feel like I've got more control over my emotions? So one side is just getting better at tolerating strong emotions. The other side is getting better at actually managing the emotions. And then another key skills area that we really work on with kids and families is interpersonal effectiveness. It's just getting better and better at getting my needs met. A lot of times, no, don't get me wrong, I've been doing this for 30 years, so I see lots of kids, and yes, kids can be manipulative, but when parents or when direct care staff say to me, oh, well, this child's being manipulative, I'm like, tell me something I don't already know. That's kids' job. That's their job. They're
Adults are manipulative.
Yeah, right.
It's not a bad thing. A manipulation is often an attempt to meet a need.
Exactly. If you step back and understand that manipulation is just an attempt to meet a need. Now, it may not be a very effective attempt to meet a need, and that's where we need to teach and help kids learn skills in interpersonal effectiveness. In other words, how can I get better at communicating my needs and meeting my needs in healthy, successful ways? So that's a key skill that we want to really build. And then the fourth skill that DBT focuses on is mindfulness. I use the term mentalizing even more so, especially in younger children. And the concept there is that we want to teach children how to keep mind in mind. In other words, we want kids to learn, oh, I have a mind. I have my own thoughts. I have my own emotions. Some parts of me feel happy. Some parts of me feel sad. Some parts of me feel hurt. Some parts of me feel angry. Because the better a child is at imagining their own mind accurately, that's key, then the better they are at learning to manage those distresses and emotions and be effective in interpersonal communication, especially when they get better at not only understanding their mind, but they begin to understand other people's mind. They can begin to understand that, mom is having a bad day, and part of mom may be, sad right now, or part of mom may be, angry right now, and it may or may not have to do with me. Maybe mom's had a bad day at work, or maybe and the better they are at mentalizing their own emotional states and the emotional states of others, the more effective they become in life and meeting their needs. So those are 4 key areas of skills building, and pretty much all therapy, whether the therapist you're working with is trained in DBT or CBT or play therapy or whatever, in some way or another, pretty much all therapy focuses on skills building in those 4 key areas, because they're the key building blocks for success for all of us as human beings.